Hello everyone, myself Dr. Jayat Nimavath, and today our topic is school health. It means health in perspective of school. We will discuss it in details. Let's check, what is it and why is important? Let's assume children are going to school and there is no any interfering program of health. So what happened? Nothing. As usual, children getting education. Leaders around the world have acknowledged schools as an important setting where children develop behavior skills for physical, emotional and social well-being. Other than the family, no social institution has greater influence on the lives of children than schools. Now assume that we introduce a health-related program in school. What happened to it? It's led to improvement of health of students that leads to improvement on enrollment, attendance and performance of students. This is not only up to schools but also affect all the stages of life of all, affecting not only health but other component of life, and that give us better next generation and so community. So, nation's future depends on the status of the children. Now, let's check it out in terms of statistics of India. You can read that major portion of population covered by children. As you can see, children are vulnerable to wide spectrum of communicable and chronic disease conditions including nutritional deficiencies, substance abuse, mental health concerns, violence, injury and reproductive and sexual health problems. A number of these issues can be prevented through school health program, but this is multi-sector, multi-level approach. Let's check it out, the way of functioning of school health program. There are basic objectives under it works. First, promotion of positive health. Second, prevention of diseases. Third is early diagnosis, treatment and follow-up of defects. Fourth, awakening health consciousness in children. And last, provision of healthful environment. In summary, you can say there is basic two component, health services and health education. So there is always involvement of Ministry of Education along with Ministry of Health at every level of program. Before proceeding to program, let's first go through history of program. In ancient India, school health was part of education since Gurukul, but in modern world, India had history of first-time medical examination of school children was done in Baroda city in 1909. That is before independence. Later on in 1957, Child Education Nutrition Education Committee and WHO-assisted school health education project were set up. In 1977, centrally sponsored National School Health Scheme was started. In 1979, the National School Health Scheme was handed over to state governments. Last since 1997, it was under RCH. And two later on under RMNCH plus A, along with two program named Rashtriya Bal Swasthya Karyakram and Rashtriya Kisha Swasthya Karyakram, launched in 2013-14. At present, in Gujarat program is in work along with Rashtriya Bal Swasthya Karyakram, covering not only school-going children but also non-school-going children also. Now let's move on to actual way of functioning of program. At present, there is a weekly activity in every school once or twice a year, practically once a year, and in winter, each day of week defined with specific work. On day 1, activities such as cleaning the school, water sources, and drainage system shall be carried out with the help of Panchayat and Water Supply Department. Medical plants shall be planted in the school as well as the village. On day 2, teachers, ASHA worker and health workers shall conduct primary health checkup including height and weight, and also carry out IC activities like rally, folk play, etc. with the help of the Education Department. The third day shall be celebrated as the Nutrition Day, and activities like cooking competition, exhibition on nutritional food and nutritive items, healthy pregnant woman competition, healthy child competition, grandparents' meeting shall be conducted with the help of Anganwadi worker. The fourth day shall be celebrated as Health Checkup Day, with the medical officer conducting health checkup for the children with his team. Parents' meeting shall also be organized on this day. On the fifth and the last day, the program shall be concluded with cultural activities like health-related plays, songs, poems, games promoting the concept of health, with the help of Panchayat and Education Department. Prize distribution shall take place in the presence of the Sarpanch of the village or chairman of the village health sanitation committee or any other dignitary. Now deviate to weekly activities. Child health screening and early intervention services under Rashtriya Bal Swasthya Karyakram envisaged to cover 30 identified health conditions for early detection and free treatment or in management. Categorized into 4 categories: defects at birth, deficiencies, diseases and development delays including disability. After the fourth day activity and spot treatment, children who require further treatment for any major illness are referred to higher center along with Sandarbh card. There is proper mechanism for referral services and free of cost treatment under this program. Move on to future perspective. Let's recall history. Since 2018, schools are recognized as useful platform. Government of India has launched school health program under Ayushman Bharat to strengthen health promotion and disease prevention, intervention. This initiative will aim to strengthen the existing programs, Rashtriya Bal Swasthya Karyakram, RBSK, and Rashtriya Kishor Swasthya Karyakram, RKSK. By strengthening the preventive and promotive aspects of health and environment of schools in line with the overall approach of Ayushman Bharat. Here, intensification of school activities will serve as a booster program which will encompass a comprehensive and evidence-based health promotion intervention that will offer health promotion activities, health screening, preventive services, documentation of health-related data, and better skills for emergency care in government and government-aided schools of India. You can find changes like age-appropriate health education, 30 identified health conditions, electronic health records and training of teacher on basic first aid. Activity structure is weekly to yearly. 2 teachers, preferably 1 male and 1 female, in every school designated as health and wellness ambassadors. The health and wellness ambassadors will be supported by 2 students of each class who would help them facilitate the initiatives and activities under the school health component. They will be termed as health and wellness messengers. Sathya is an application and helpline numbers will be used for discussions and transacting sessions. To address the queries of the students, a question box will be installed in schools where the students can put in their individual queries anonymously to prevent any bias based on question asking. School health under Ayushman Bharat is well-defined program to cope up with current health situation. This include age-appropriate health education, identified resources from school to district level, defined role of each individual who will be trained and will conduct session as a part of structured activities, screening of defined 30 health conditions. All will be supervised as per plan and records will be digitalized to measure defined indicators. This is all about school health program. See you in next session. Keep reading.